All right, making sure it's recording for others who can't make it right now, who will be watching this later, and then we'll have this accessible to them. Also hopped online on Instagram, so I'm just doing my Zoom right now. You guys won't be able to see when I screen share, but I figured why not have it on here too. Hi. So if you have any questions about my course, drop them in the chat. I'll make sure I pull my chat up here too. So I have that on, and then we'll get to the questions a little bit afterwards too. So this will be recorded too. If you have to hop back on later, you can get your questions answered as well. So first, I just wanted to share kind of a little bit about me and what led me to to creating this course. It's not only my own journey, but my family's journey too, right? So after I had my daughter, she had feeding difficulties right away. She couldn't latch, although in the hospital they got her to latch, right? They got her to latch a little bit, but she was super gassy and every feeding was just a struggle. It was hard to keep her awake. She was always had a burp, took like 5 minutes just to burp her. And I had a feeling that she was tongue tied. At the time, I didn't know much about oral tethers, but my niece did have a tongue tie at birth and she had gotten that released. So I like knew a little bit. We didn't get taught too much about it at school, in hygiene school, because there's just so many other things that you need to be learning about, right? So initially our pediatrician was like, "Oh, she's okay. She's okay. It's not that." But I wasn't able to breastfeed her. I was just kind of pumping, and then she was using the bottle, which she still had difficulties with, right? So after about 3 months, he agreed that she needed it addressed. At this time, I was returning to work. So I was like, oh, all right, well, she needs it done. We're going to do this. Okay. I was going back to work, like, I think it was 2 weeks or the following week after she had her ties released. So found a preferred provider in the area. That is like something I will stress to you guys. Okay. So at this at this time, we went through that with her. And at the same time, I was having my own symptoms, my face, pain, shoulder pain, tingling sensations, kind of tension that I couldn't explain. I'd had braces at that time for 3 times, and I was going to kind of provider to provider, trying to figure out what was going on, right? At the time, I'd also been a hygienist for 8 years. So I was like, okay, maybe this is just kind of musculoskeletal pain. This is just what happens, right? I just have to kind of deal with it. It started to kind of take a toll on my mental health too. And that's when I started to dive deeper with my daughter's journey as well. We were diving into airway, posture, function. And throughout that whole process, I found myofunctional therapy. I actually found a physical therapist who had gotten educated in myofunctional therapy from her own jaw pain, right? So I sought out a physical therapist because I had shoulder pain, jaw pain. I was like, okay, what can help me? This helped me so much. And I was also able to do my visits online as a new mom. My daughter was right there. I could tend to her if needed. It was not easy, but it was doable, right? So it just helped me realize that addressing the oral dysfunction in me and her just makes a world of difference, right? Once I saw how powerful this was, I knew that I had to share it more with others. I was seeing patient after patient as a dental hygienist cleaning their teeth, just like, oh, like connecting the dots and everything, oral dysfunction right here. And I thought, families, parents, they need something doable. Not everyone can commit to full one-on-one therapy, driving to appointments, even financially paying for one-on-one therapy, right? So maybe they just want to start learning and applying what they can at home. And that's when I really realized that this course is something that I wanted to do. And it's something that I wish I had, kind of, right? So, what's the course? It's 14 modules, and each module has about 6, maybe 7 exercises. You do the same set of exercises for 2 weeks. and then it automatically moves you on to the next set of exercises. So the exercises take about like 5 minutes morning and night. It shouldn't take you very long. It's just simple exercises. You do it with good posture, feet on the ground, hips, shoulders stacked, standing up, looking at yourself. You do these exercises and you start implementing small things. It's not one-on-one therapy, but you're able to learn the exercises on your own, like on your own pace, at your own time, maybe 12 o'clock, 2 a.m., whenever you want, a little bit here, a little bit there. Okay. So it's not one-on-one therapy, but it helps you understand simple things that you can do. Everything's inside EverFit and it's really easy to use. You can watch your exercise videos, you can mark them complete. I'm going to show you in a minute here. Okay. You can mark them complete and it's really, really easy. Okay. So let me see. Let's see right here. I can kind of show you guys what it looks like. So we'll use, find it here. Oh, here we go. This is what it looks like right when you log on and download it. So you'll have your welcome page and then kind of read through that. Then you also have your disclaimers that you'll do. It's for educational purposes only. This is not medical advice. I'm not diagnosing anything. You're not my patient. You need to consult with a physician, some documents. Now, I also have, so then we'll do right here, you can see kind of what it looks like. Let's do here. So I can flip this and you guys can kind of see as well a little bit. But here we have the modules that you'll be doing. So you have the same module for 2 weeks, the same exercises that you're doing. And then after 2 weeks, you get a new set of exercises that you're doing here. So some of them have alternatives, like if someone can't put their tongue skinny, what they can do instead. But then when you're in here, let's see here, you can see, okay, so you have these exercises here that you're doing, and then you can see a video doing the exercise too, right? Kind of how to do the exercise. You can always go back and reference this as well. So multitasking, right? Back down there. That's kind of a little bit that shows that. I also want to show, you can see you'll have tasks that you can do. So you have the option to upload photos if you want. You don't have to, but it's really fun to track your progress, okay, and to share them if I'm able to, if you allow me. And then feedback. So this gives you like medical history. I can look at more of your medical history there. And then this is the disclaimer. Some other tips. So this is also free for the first 7 days right now. I can't say how long this will last, but so then you some tips in there, and then I want you to check in with me. I want to know like what's going on, how things are going, right? You'll also have right here some welcome videos, and then the how to do the exercises. What is myofunctional therapy? Breathing, about my journey, a sample of an evaluation, a parent's journey. Now, a lot of these videos are on my YouTube too, but a lot of the videos as well are on my YouTube that I'll show you right here. So these ones are the ones that are accessible in the free 7 days. So that way you can get that education and kind of start learning about what myofunctional therapy even is. Okay. Now, this is an evaluation for one on one therapy, my journey, a parent's journey after they did some speech language. They saw a speech language pathologist and then they saw me a little bit and what we've gone through. So that's a little bit about kind of the course. Now it's 14 modules, it's 28 weeks long, goes on its own. Everything goes on its own. So you go on the next set of exercises every time. So who can do this course? Really, anyone, right? If you're a parent and you have multiple kids, this gives you a cost effective way to work together with your family, learn as a family. Maybe someone's in braces or planning like airway work. If someone needs palate expansion, okay, there's this function there, right? So this gives you a strong foundation between visits. It's not one-on-one therapy. So if someone's needing a tongue tie release, I recommend them or you reach out to me. We can do sessions prior and work through them. You need like 4 or 5 sessions. Some people need 8 sessions prior. You need to not only have sessions before a release, but after too. I see those people, like those patients, a couple days after a release. I'm having them send me photos. Like it is way more in depth. Does not replace that at all. Okay. Now, you can reach out to schedule an evaluation if a release is being recommended or if someone needs a release. Okay. Now, if you're dealing with jaw pain, clenching, you're thinking about Botox, this can help address the cause first because we're addressing the muscular dysfunction. You think Botox, someone's getting Botox, it's making the muscles not work there, but how are the muscles working otherwise? We need to be looking at that too. Okay. If you didn't do before or after, would this course help them? Yes. If if they have already had their release done and it's healed and they need myofunctional therapy, yes. Yes, this course would definitely help them. It's exercises, it's a lot of different exercises that would help anybody. um, if you didn't do myo before or after a release, it could help them. And then maybe possibly it's a possibility that they may need more, like some people need a revision. Maybe the first wasn't done well enough. So this can help you before. And then you can still get more one-on-one individualized therapy if you're finding that, okay, you need a revision, you need to have this release addressed again, then that would help. Um, so who else would it be for? If maybe you have a night guard, your night guard's not working, you're still clenching and grinding your teeth, you guys, the night guard's just protecting your teeth. This course can help you understand why. How is your tongue during the day and when you're sleeping? This can habituate it during the day, eventually over the night. If maybe you're a provider and you want to kind of learn, like, okay, can this help some of my patients? You can take the course if you want, or it's also a good referral source for families who need extra support. Maybe you're a dentist and your patients are breaking their fillings because they're clenching so hard. They're wearing their night guard though. Maybe the patient's getting lots of cavities. Mom's like, they don't eat bad. They brush their teeth, like their oral hygiene's good. Why are they getting cavities? Maybe this course can help them, parents of multiples. Okay. Um, my one-on-one therapy program's around 1,800. So that's for 14 individualized sessions. This course is $444 and you get the 14 modules, not their my 14 sessions are like totally individualized, right? So you just get the basic 14 modules and the education about it. It's a higher investment, right? See where the some questions are coming in, so I'm just making sure they don't get lost. But so there's also an option to have support with me. You can add on, like maybe you're just doing, you got the course and you're like going through it. Then after a couple weeks, you're like, oh, okay, I have questions, or oh, this one's different. This one's causing difficulties, right? You can add on the Q&A with me additional. And at the end of this, I'll have a little promo code too for that and for other things as well. So the Q&A, I'll have like, you guys can ask me questions about exercises or maybe things you're noticing in others or your kids. We can kind of chat about those things. I'm also going to have providers come on each month, someone like a physical therapist, an orthodontist, a chiropractor, occupational therapist, speech language pathologist, to give kind of a broader perspective, because it's not just here that we're working with, it's the full body. Okay. I actually had braces turned, like in the end, I had braces 4 times because my tongue thrust was going on. There's a lot of muscular, sorry, I'm talking a lot with my hands. There's a lot of muscular dysfunction there. So I'll bring on other providers. And if you're in this Q&A monthly access with me, you get the recordings in them. You get it in your Google Drive too. So I know I said that share my screen again here, but we'll have the EverFit updates every 2 weeks, but then you'll also have access in Google Drive of the recorded exercises too. So show you here in Google Drive, you have the videos, and then you'll get access to the exercises in there too as you're going through. And then if you're in the VIPs, then you can have access to those videos as well there. So we'll see that I wish I had something like this, right? Why does this work though? I think is because even though I'm seeing, I can see clients maybe every 2 weeks, every 3 weeks, once a month, right? But they're not practicing every day. This can help. You can watch the videos, you can check that you did it every day. You can kind of get a little bit of feedback from me here and there if needed. But it will really help, I think. And you don't have to guess what to do. It's kind of like when you go to the gym, a workout class, and they already have the exercises going for you, right? So we'll see. Anybody has questions? And I have some on here too that some people have asked prior. Yes. Okay. That's a great question. And I can show you some grades of it. For those of us without a medical background, what is a tongue tie? So I'll show you the grades. So like I said, I can't diagnose it, but I can show you these grades here. Dr. Zagi's done. And you can see right here. Okay, so these are grades of restriction. It's when the right here, like you can see this function might be more impaired. These down here, the tongue can't move as much. So the jaw is having to compensate more. The cheeks are having to compensate a lot more. The lips. So actually, we'll go into that in a minute, but you can see the tongue is being functionally impaired. Like, how is it working? Can it do certain things? Can you do a taco with your tongue? So can you do or can you do a bowl? If you open and put the tip of your tongue to that spot behind your 2 front teeth. So if you open and put your tongue to that tip of the spot, do you have to close your jaw a lot? Or do you does it kind of just go there? So if you have to close it a lot, that's showing us, okay, could be some restriction there too. But it's not like, okay, you need to go and get this released. And we're not saying, I'm not saying that at all, right? But we can work with the function, a lot of the function. So I have, let's see, I have my one of my clients that I can show on here. So this is right here, her in the very beginning. And then we have, and I'll show right here too. So in the very beginning, and then we have after 8 weeks, but we can see, okay, that tongue, she would have to close a lot to get it to that spot, right? There's compensation happening. She's still getting some headaches, realizing, okay, a lot of neck pain. Even though we were working a lot with the function, she ended up wanting to get it released. Okay, so worked through her post-op. So the top, this was before, after she did 8 weeks of myofunctional therapy. And then this was after the healing process there. And then we continued with it. So eating, how is your tongue when you're doing these things, right? So we continued with that there. Then what I want you guys actually to do, if you can, this shows a lot about your tongue and your lip function too. So if you have a little bit of liquid, step back from your electronics, just get a little bit and then smile before you swallow. So it looks like this. Can you do that? If you can't, if you have to head nod or you have to close your lips, you're like, I cannot do that. This may help you. Okay. So some other questions. Can multiple people in the same household use it? Yes. That's my goal, like maybe you're doing this, you're working through it, and maybe after 2 weeks, like maybe the exercises have expired and you have to hop on the Google Drive to look at the old exercises. But that's my goal with this is maybe you're a parent and then you're like, oh wait, my kids can use this too. You guys can do it all together. Bonding, family bonding, right? If I fall behind or miss a few days, you have the Google Drive that you can go back and look at the exercises. Do I need equipment? Sometimes, yes. Sometimes you do need a little bit of the equipment. A lot of stuff, it's like one of the things I have is a button and some string. So sometimes you can find things around the house. I also do have the option here. Let's see, I can find it on here on my website under products. It's actually on there too. But on here, under products, then you can, I have this right here that you can get too. I think it might, I don't know, it might be on sale right now. Honestly. Oh yeah, it still is. So it's still on sale, you guys. What is a tongue tie? But the myofunctional therapy supplies kit, if you want to get the supplies kit and if you want to just get all the supplies shipped to you, you don't have to worry about anything, then I have that option too that you can purchase that. What if I'm already seeing another provider, like a myofunctional therapist or an orthodontist or a physical therapist, speech pathologist? This like depends, but I can get in touch with them too. We can like work together. This all just complements everything. Yeah, if you're seeing another myofunctional therapist, like that's okay. Might complement it more. I have had clients who have seen other myofunctional therapists in the past, and we've had great results after our care too. How long do I keep access? So the EverFit course is 28 weeks, and then after that, you have the Google Drive for a year. You can have that on there. You have the exercises recorded that you can watch for a year after. Is the course one payment or can one pay in payments? So you can do either one payment or you can do two payments. So it's one payment of 444 or it's two payments of 222 for those of you who are into numerology. And then the Q&A monthly, you can always add that on whenever, and that's $42. What kind of results can I expect? Okay, so awareness comes first. Like you'll start noticing different things like, okay, maybe my lips are open more, I'm clenching more at these times. You might notice different habits that you're doing with your mouth or with your fingers, right? But after consistent practice, you might notice you're sleeping better, not snoring, less anxiety, things like that. So it's all a journey. Is this okay for adults too? Yes. Yes. Like, okay, so I see clients ages 4 and up. And it's hard, especially when kids are in school at that time too, right? So I see like a lot of adults too. I have patients, I have clients and they're like 50s, 70s, 30s, male, female, everybody. But really my goal with this too is to help even like the young ages younger than 4 because there's so many things that you can do before the kids can even see a myofunctional therapist, right? But definitely adults too. This is great for them. Like that's what helped me so much, getting less migraines overall and just everything. So let's see. Can this replace orthodontic or surgical work? Okay, so no. Well, no, it cannot replace it. It can support it because you think like orthodontic surgical work. You think you want to get a knee surgery, a hip replacement, you want to do that without physical therapy, right? So this is the muscular therapy going with it. It's support. It's focusing on the muscles. Um, but think like I was just saying, like you can't do one-on-one therapy until like age 4 typically because it's so hard. But about I think it's 60% of skeletal growth is done by that time. So that's why like implementing the tongue up on the palate, getting that tongue up there to broaden the palate and the facial skeletal growth, the lower jaw will follow with the lip closure, and that will help. 60% is about done, I believe, by age 4. So getting those things that can help prevent orthodontic work and surgical work, possibly. It's not a replacement, but in the early years, it can definitely help. That's why I'm so like early intervention. Okay. Um, see here. My child did speech therapy. Will this help? Yes. And actually, one of my interviews on YouTube is talking, like, is one of my clients who has a similar story like this. Um, so you guys can check it out. But myofunctional therapy helps strengthen the underlying habits in the tongue, posterior muscles. There's 16 muscles in the tongue, so it's helping all of that, right? Tongue mobility, breathing, swallowing, it complements it all. I was in speech therapy for 6 years. And I mean, I know I was in school settings. I don't know if it was because there's like a gag order in place or whatnot, but I don't think anyone looked at my tongue that I know of. So that's fun. Until I was like 30 and got it released after I did myofunctional therapy. But this is why I focus a lot on education and getting the knowledge out. Okay, what if my child has a tongue tie or I think they do? Myofunctional therapy is best to do like before and after. It helps prepare the muscles, improve coordination, strengthen the jaw so that the release is more successful. Don't do the release without myofunctional therapy. Don't get it by a provider who is doesn't know about myofunctional therapy or doesn't recommend it. Make sure you have post-op visits and a preferred provider. My course does not replace this. You can also set up an evaluation with me if this is really seems to be needed. Can parents do the exercises with their kids? Yes, that's what I love most. It becomes like shared. You're doing it with them, you're bonding, right? Your kids take on your habits. They see you doing something. So, like, even if you want your kids to be doing the exercises, it's probably better if you're doing it with them. They're probably more likely to be doing it that way. I'm just looking at the different questions coming in. Let's see. I'm A provider, how can I refer families? Okay, so you can direct them to like to my course, to my website, or you can just message me their information. I can reach out to them. If they are needing a release, please specify. So I kind of know like the urgency of it, but it's a great in between resource kind of for those that need the functional support, I think. I'm already in one-on-one therapy. So yeah, I can absolutely complement it. You get extra practice, you get like 28 weeks of exercises, the library of exercises, the toolbox, even if you just do the Q&A, like say you've already done the one-on-one therapy, you just want to do the Q&A, you can get the extra advice from other specific providers that you can ask them questions too. You can get access to their recordings too. But how do I know if I need the full course or just want to start smaller? Ooh, okay. So that's a good one. Okay. I'm actually creating something, um, MiniMyo. I'll give you a brief overview of it next. So you can start exploring kind of before, but I want to make sure if there's more questions first. Make sure we kind of went over things. So um, if if someone's like really mouth breathing a lot, jaw pain, clenching, grinding, you know, maybe someone's in braces. So you're already spending like a pretty penny on braces, right? My course is more accessible to add on. There's a reason why they're in braces. So there's a reason why someone's in braces, their tongue wasn't up on the palate, right? Shaping that maxilla. My course is able to add on to that and benefit it even more. So you don't end up with braces 4 times like me. All right. So just making sure on the Zoom, there's no more questions on here. And then the ones we had before. Okay. So I want to talk now a little bit about my MiniMyo course. So, okay. I realized, okay, 14 modules. A lot of people don't even know what myofunctional therapy is. They're like, oof, I don't know about that. But some people want to learn or they want their kids to learn. So I created MiniMyo. Close your lips. 2-month parent-friendly course, playful exercises you can do with your child. You can just do it, it's for you too, not just kids. But it's perfect for anybody who wants to try things out, build awareness. You can start noticing changes before actually like committing to the full program. So normally the course is $175, and I'm going to give you an intro price of $150 for joining early. So I'll have everything linked shortly. But message me if it's something that you're interested in as well. But I'll have it up on my website shortly too. So what it is instead of getting the 28 weeks of exercises, you get 2 months of exercises, kind of an intro. They change up a little bit faster than every 2 weeks. And then you have access to those videos for the 2 months. You can save them, you can do them as a family. You can kind of start to experience with what myofunctional therapy is without the big financial commitment. So if you're not quite ready for the full course, I think it's a great place to start. I'm going to have it linked shortly. I've been working on it. So stay tuned for that. Thank you guys so much for joining, though. I love being able to kind of share this work and show you what's possible when you start paying attention to the function, posture, breathing. And if you want, the full course is actually available through Everfit and linked on my homepage at mvmyo.com. So you get access right when you sign up, and it just goes from there. You can pay in full or you can split it into 2 payments. And as a thank you, guys, I have a promo code that I want to offer of LIPS10. So that's capital LIPS 10. And you can use that promo code when you no matter how you pay. And if you want to start with MiniMyo, message me, let me know. I'll let you guys know once it's active on the website. And my goal is to just help more families kind of understand how daily habits, how we swallow, how we breathe, our posture, how we're walking, how it makes a big difference in our overall health and just development in general. Thank you guys so much for being here and joining me. And remember to keep your tongue up, lips closed, and breathe through your nose. Don't be clenching either. I'll have this recording saved for those who weren't able to hop on, and then it will be on the Instagram as well too on here. But thank you guys and have a great day.